question really is, how can I tell if BVD is affecting my herd? And so I've got a bit of information, just a bit of background information to start with what's going on in Europe and then closer to home in the UK. And then I'm going to talk more specifically about the disease, how it affects individuals, and then what this might mean for your herd. And if you want more information after this webinar, there's a lot of good information that we hold on the RVC website here that myself and Professor Brownlee and others in the BVD group here have put together. So do go and take a look at that if you want to know more about the disease. So I always like to start these presentations by just sort of setting the scene and telling you a bit about what everybody else is doing. So what's going on in the rest of Europe initially. If we look at the map, we can see that the countries with white dots have got national schemes that are underway, and those countries with blue dots have got regional schemes. And the thing that always strikes me about this map, and perhaps I'm being a little bit harsh on England and Wales, is I haven't put a dot over either of those at the moment. We've got some things that are going on, and I'll talk a bit more about them in a minute, but in terms of coordinated national control, we're not quite there yet. The main countries, I think, to highlight out of these, though, are the Scandinavian countries, and they've been very proactive in terms of getting rid of this disease. And they started their programs back in the 1990s, the early 1990s, and they probably took about 10 years to get rid of the disease. They really only used 2 tests. They didn't use vaccines, and they were concentrating on getting rid of persistently infected carrier animals. So these are animals that I'll tell you more about as the presentation goes on. But these are animals that spread the disease between herds, and they're animals that, if they're present in your herd, are affecting the others and infecting the others with the disease. So Denmark, Norway, Sweden and Finland really took a sort of 10-year period to get rid of this nationally, and now they take this quite seriously, and they've got quite strict import regulations to ensure that the disease doesn't come back into their country again. So coming on further down into Europe, Germany have a program in place, Switzerland have a major program in place, Austria as well, France more regional programs, but there's a lot going on around the continent really, and closer to home, Ireland, Northern Ireland and Scotland all have national schemes in place now, and so we're getting a bit left behind really in England and Wales, I think. If we talk in a bit more detail about the Irish, Northern Irish and the Scottish schemes there, first thing to note is when they started. So Republic of Ireland started in 2012, and then really it was followed fairly quickly by Northern Ireland, because there was a lot of trade across this border. There is a lot of trade across this border, and so it made sense for Northern Ireland to do something. And they've based their schemes mainly on tag and testing of young stock, and we'll talk a bit more about that next week perhaps, but some of you might have heard about tag and test, where you take a small tissue sample when you put the ear tag into young cattle, and that can then be sent off and tested to see whether you've got a PI as a youngster running around the farm there, and you can get rid of these animals quite early on before you've put much investment into them. So Ireland, Northern Ireland both have national schemes that are running now. If we come a bit closer to England and Wales and talk about Scotland, the Scots are now entering the 3rd phase of their eradication programme, and really everything that Scotland have done has hinged around trying to prevent the production and the circulation of these persistently infected PI animals. And so what's happening there now is they're really making the scheme compulsory, and if a herd cannot demonstrate freedom from BVD, there are regulations that are put onto that herd to prevent them from moving animals to other farms without individually testing them first. And then we noticed the other day that there was another article in the Farmer's Guardian about the Scottish programme there, and basically from June of this year, herds with a not negative or unknown status will be placed under restriction, and only animals that are able to be the only animals that will be able to be moved from those herds, other than direct to slaughter, will be those that are tested individually as negative for BVD before they move. So this is being taken really seriously in Scotland, and it is having trade implications on the border with England in the north there. So a lot of people, if they're trading up into Scotland, are having to adhere to these regulations anyway. If we just look at a little bit of progress here, we can see that about 83% of herds quoted in this article in Scotland now have a negative status. So they're doing really well at getting rid of this disease. So there's a lot going on quite close to home, really. If we look in a bit more detail at England and Wales, I'm maybe a little bit pessimistic about what we're doing, but there's an awful lot going on here as well. And I think the key thing is we need to start to coordinate it. There are numerous schemes that are practice-based or regional, and some of you might have been involved in those at some point. So RDPE money, which was received from government funds and regional development funds, has gone towards trying to kickstart BVD eradication schemes all across England and Wales. But at the moment, we've got nobody who's centrally coordinating these, and I think this is a key thing that we really need in order to take disease eradication forwards across England and Wales. We've got lots of different herds in different areas, and they'll have lots of different problems. So we've got a number of herds on the screen here. Herd up here that suffers from IBR. This herd has a mastitis problem, BVD, lepto. This guy's got a Johne's problem over here, but he grazes his cattle right in the middle of these herds over here. And so lots of people have lots of different problems. And what we tend to see at the moment is that we tackle these on an individual farm-by-farm basis. And so this farm solved his IBR problem, but he's gone and got a BVD problem. This chap's fixed his BVD problem, but he's gone and got lepto. And I think until we start to work together as an industry as a whole and start to work towards common disease eradication aims, this is probably going to be a bit of a problem as time goes forwards. So an individual herd, we could easily remove BVD in 2, maybe 3 years, and I've done it as quickly as 18 months in some herds where we've had committed farmers who have tested for persistently infected animals and have culled them out of the herd quickly. Regionally or nationally, it's going to take longer. The Scandinavians, as I said, took about 10 years, and it's going to need coordination and a lot of commitment from a larger number of producers. But we do know it's possible. We know a lot about this disease. We know a lot about its pathology. We know a lot about the tests, and we've got good tests that are reliable as well. So we know we can get rid of this disease from individual herds and larger groups of herds at a regional and national level. So, costs of BVD infection. This slide is a bit wordy, but it gives you a bit of an idea about where BVD sits in the sort of grand scheme of things with other infectious diseases. This was from a paper in 2003, and the conclusion was that BVD was costing almost £40 million per year to the UK cattle industry, and it put it fairly high up amongst some of these other infectious diseases here. So it's a major cause of economic loss to the UK industry. And we can see here that only lameness and mastitis came above BVD in this table. Mastitis was a whopping 180 million, and I know it's something that everybody listening to this is going to be concerned about, but BVD came top of the list of infectious diseases that we're talking about here. The main area is because it causes reproductive disorders, so fertility disorders in infected herds, and it's immunosuppressive, so it also makes other diseases worse. So if you have an animal that's infected with BVD, the immune system won't be able to work properly, and so the likelihood is that other diseases such as pneumonia, scour, mastitis maybe, lameness particularly, they can all be made worse because an animal is also infected with BVD and is immunosuppressed because of that BVD infection. At the individual cow level, because this figure of 50 million is quite hard for an individual farmer to sort of get their head around, I think, but at the individual cow level, some papers from the Scottish Agricultural College have estimated that the disease costs about £37 per cow per year. And this was calculated in suckler herds, and we believe this figure is probably a bit higher in dairy herds. On an individual level, we can test a cow to see if it's a carrier animal for BVD for about £3 or £4. And so if we can get rid of those carrier animals, we can easily save this money. And spend a little bit of time talking about the disease and the pathogenesis. Now, there are two main points that I think we need to understand in order to control the disease efficiently at the herd level. The two areas are persistent infection and the acute disease. Now, I never really know which order to put these in because they're both really important. The persistently infected animals are lifelong carrier animals, so that's how they get this name, persistent infection. They carry the virus and they shed it in all bodily secretions, and particularly in the nasal secretions. And basically, these things infect every animal that they come into contact with. So persistently infected animals are very important in the epidemiology and the spread of this disease. If you've got one in your herd is infected. If you sell one without knowing it, then another herd will become infected. If your neighbours have them, then you've got this possibility of transmission over the fences. So suddenly your boundaries become an issue as well. These animals are really important in the spread of the disease. You might have heard of this syndrome called mucosal disease at some point as well. This is almost an end stage for persistently infected animals. Mucosal disease only occurs in these PIs, and I'll talk a bit more about how it occurs and why it occurs later, but it's always fatal. These animals tend to go downhill very quickly over a 4-week period. They have hemorrhagic erosions on the muzzle and throughout the gastrointestinal tract, which means they have this hemorrhagic bloody diarrhea. They waste very quickly, and mucosal disease, when it occurs, is always fatal. The other is the acute disease. So not all animals are persistently infected, but the persistently infected animals will infect other animals and cause them to become acutely infected. So a normal animal, not PI, if it comes into contact with a PI, will catch the disease, will suffer with it for a variable amount of time, then it will produce an immune response, get over the disease, and that immunity is fairly long-lasting after that. But in the acute phase, when it's affected by this disease, there are two main areas that it can affect. One is reproduction, and so we see fertility effects, and I'll talk a bit more about those in a minute. It does affect both males and females, and so it will affect male and female fertility. And then the other area that it affects, as I've already said, is immunosuppression, and so it can make other diseases worse by immunosuppressing these animals at the point it infects them. So you could almost think about BVD in acute infection as a really bad cold. The animals will get it, they'll suffer with it, they'll be under the weather, they'll be more susceptible to other diseases. You might see these fertility defects over that deficits over the period of acute disease, and then eventually after 3 to 4 weeks they'll get over it and develop an immunity after that. If we look at the specifics of acute infection, what we're really looking at is the fact that this is a fairly mild disease, very widespread, and many, many herds in the UK have been exposed to it. So we estimate that 90% of herds have been exposed, and probably at any one time up to 60% of herds are actively infected, and by that I mean up to 60% of herds contain a PI. As I said, the virus is cleared in about 10 to 14 days, and within a month the animals are pretty much fully recovered from it. And over that 10 to 14 day period, there's an antibody response that develops, and this antibody response is protective and it lasts for quite a long time. And this is the sort of thing that we're measuring when we often take bulk milk samples and look for antibody in the bulk milk. Now the thing I want to highlight is, whilst I've got mild disease up here, don't be fooled by the fact that I've said it's mild. The immunosuppression and the fertility effects can be particularly severe, particularly in herds where there's very little pre-existing protection or immunity against the disease there. And then over that period of acute infection, you can often see a milk drop in these animals as well, so their production will dip over the period of acute infection. This can often be quite subtle, so we might not always see it, but there's no doubt that by removing BVD from a herd and removing acute infection, you can increase production here. If we look at immunosuppression in a bit more detail, the key thing to this is that it makes other diseases worse. And the main areas where we see this are respiratory infections in calves and enteric, so scours in calves. So if you've got this immunosuppressive BVD that's going through calf groups, respiratory disease with IBR, RSV, influenza, these are all going to be made worse because of the immunosuppressive effect of BVD. And it's the same thing with scours as well. If you've got BVD in a group of animals, these animals are more likely to succumb to scour and suffer more severe scours because of it, because the animals can't fight off these diseases because of the immunosuppressive effects of BVD virus. In some of the work that we've done looking at this disease and eradicating this disease from herds in Somerset, we looked at the use of pneumonia drugs in herds that had BVD infection. And this is just the results from one herd that we were looking at. And basically, up until this point, PIs were present in this herd. And we can see that there's a peak in medicine use for treatment of pneumonias in these animals around housing time, so the winter time of every year. And here we started to remove PIs from this herd, and we see very little use of the medicines over the next winter period. This tends to be what we see. If we remove BVD, we improve the situation regarding other diseases on the farm. So we've started to make an impact on the pneumonia situation on this farm by removing the effects of BVD from this herd. It was the same thing with scours as well. We saw peaks in scour use. This was early autumn, and this was later autumn and into the winter of 05 and then 07. And once we started to remove PIs from this herd, we just didn't see anything after this. So removing BVD, removing the persistently infected BVD animals from these herds, removed the immunosuppressive effects of that virus, and therefore meant that scours didn't get to the point where they needed to be treated with rehydration tablets and things like that in this herd. If we move on then to reproductive disease, key thing about BVD is that the virus will infect the adult animal, but it will also cross the placenta and infect the fetus. Fetal infection, congenital damage, abortion, these are all effects of BVD infection of the fetus. And probably most importantly, we can see the creation of persistently infected animals is another effect of fetal infection in these animals. The big thing really is that, or the end result of fetal infection is completely to do with the timing of infection with regard to the period of pregnancy that the cow's in. So if we have a little look at the months of gestation here and just run through them, we can see that if the cow is in the first month of gestation, if the fetus becomes infected, we may just see early embryonic death. Now, this often comes back as just repeat breeders, irregular returns to service and things like that. So these are picked up because you've got a cow that you've PD'd in calf here, and then a month or so later, she comes back bulling again. But these fertility effects can run right up to about the month 6 of pregnancy here, so almost 2/3 of the way through pregnancy. And you can see fetal death, abortion, mummification, more or less all the way up to month 6. In naive herds, you can often see quite severe abortion storms if BVD gets into the herd. So the effects on fertility here can be quite severe. The next thing to mention is the first 3 months of pregnancy are the key time when for the production of PI animals. If the fetus becomes infected in the first 110, 120 days of pregnancy, this is when we potentially get the production of a PI animal. Fetal infection at this point could result in abortion. So not all PIs are born, some of them are aborted, but if these PI animals are not aborted and they do run to term and they're born persistently infected with the virus, and they're constant little virus factories that are running around your farm and infecting other animals and potentially producing more PIs if they infect pregnant animals. The other thing to mention are these congenital defects, and by this we mean defects in the fetus. And the most common ones, and I don't think they're extremely common these days, but the most common ones that are quoted in the literature are calves that are blind or have sight problems, and this is primarily because they have cataracts or retinal defects that are caused by BVD infection in the uterus. We also see clumsy calves, and this is because the part of their brain, the cerebellum, that controls coordination is poorly grown in these PI animals there. So we see clumsy calves that can't coordinate themselves. And the other thing which you may also relate to Schmallenberg virus as well is that we see calves with deformed limbs as well, so knobbly knees, fused limbs, that kind of thing. And so they often, they might appear to be, to look like animals that have suffered from Schmallenberg infection in the uterus as well. So these are the outcomes of infection of the uterus, and as you can see, they're very specific to the timing of pregnancy here. Generally, if we see infection of a pregnant animal after month 6 of gestation, she'll probably give birth to a normal animal. Sometimes these can be weak, but more often than not, infection of the pregnant animal at this point of pregnancy doesn't have a major effect on the outcome of the pregnancy. Just to give you a bit of an idea about the numbers, in two large experiments that were undertaken in 1988 and 1993, looking at pregnancy rates in uninfected heifers, they were able to get pregnancy rates of up to 80%. But once BVD was introduced into that mix and these heifers were infected with BVD, the pregnancy rates dropped to 30% or lower. So there was a severe hit on pregnancy rates taken because of BVD infection in these animals. If we move on now to concentrate a bit more on the effects of the PI, or the creation of the PI animal, we'll run through how these animals are created, because if we understand how the PI is created, we can understand how to control this disease effectively. One question that I get asked quite frequently is how many PIs am I likely to find in my herd? And the answer really is that they tend to range between 0.3 and 3% of infected herds. And the work that we did in Somerset found that in herds that were not using BVD vaccine, the number of PIs present were between 1 and 3%. So it's not huge numbers. It could be 1 to 3 in 100 animals that we're looking at here. But if they're present, the thing is they're infecting the other 99 animals, the other 99% of animals that are present in the herd, and you could be having all of those effects of acute infection on the rest of those animals, and that's where the main economic loss because of this virus comes in. Understanding how PIs are created is quite important, and if we just talk through pregnancy, we've got a cow here, and she's not PI herself, and she's pregnant, and if she's in the first 110 days, so the first third of pregnancy, and she comes across a PI, the problem we've got is that she becomes infected. And because she's become infected, this virus will cross the placenta and infect the fetus as well, and so the calf becomes infected. So we've got an infected cow and an infected calf at this stage. Now, this cow's normal, she's not PI, and so she's actually able to mount an immune response. So she produces antibodies and she's able to clear the virus. But the problem we've got is that the bovine placenta is very thick and these antibodies can't cross into the fetus, and so the mother's antibodies have no effect on the virus in the fetus. Now, at this point in time, the fetus is starting to recognize all of its own self-antigens, so it's recognizing its own skin, its own blood cells, and all of the rest of it. And BVD is in there in the mix at the same time as this. And so it recognizes BVD as self-antigen as well. And what the fetus tends to do is delete anything that's going to be self-reactive, and that's how it avoids developing autoimmune diseases later on in life. So it'll delete anything that will react with its own blood cells or its own skin cells and things like that. Because BVD is in there as well, its immune system deletes anything that's going to react against BVD. And so if this little fetus isn't aborted and the gestation runs to term and this animal's born, it's deleted everything from its immune system that's going to fight this virus, and so it's born immunotolerant to the virus. It can never produce antibodies and it never clears it, and that's why it's persistently infected. And so these animals are shed high quantities of virus in all of their nasal secretions, milk, urine, feces, and they're very, very infectious to other animals. And so if this animal's on this farm and it comes into contact with another one of these pregnant animals, this whole process can continue and you can see the birth of more PI animals. So these creatures are critical really in the control of the virus. And if you can stop this infection of this fetus at this point, you can get rid of this virus. And to do that, we really need to get rid of these PIs from our herds. How old are PIs normally? The commonly quoted figure in the literature is that they will be dead by about 18 months. In the Somerset studies that we've conducted from the RVC here, we looked at 35 PIs that we identified, and we found that really half of them were under 18 months, but the other half nearly were over 18 months of age. And so don't be fooled into thinking that these animals all die as youngsters. Some of them can make it to 2 years of age, and we can see the line here of 2. So these animals here, this third of the group at the end here, are of milking age. We're trying to get these animals in calf. They're mixing with other in-calf animals, and they're potentially suffering from the disease and spreading it around the milking groups in these herds. So the message I think here is a lot of them will be youngsters, but don't be fooled into thinking that they're all youngsters and they die before they become adults. If we were asked to spot the PI in this picture, you'd probably pick this one out quite easily over here. These two calves are the same age here, but you can see this is a typical appearance of a PI: stunted growth, poor carcass, and they just don't grow as well as their counterparts that are non-PI in their herds. This was a common description of PIs, but probably more commonly is this kind of picture here. If I asked you to spot the PI in here, most people have trouble trying to pick the animal out. They pick one at random. This girl here was the PI in this picture. She looks pretty much normal compared to the rest of her herd here, so you can't always tell the difference between the PI and the other animals in the herd. They don't always appear to be stunted animals with poor coats and poor carcasses. If we just finish off on the PI animal and talk just finally about mucosal disease, it's an end result really for persistently infected animals. And what we see is a superinfection, a mutation of the virus that this animal is carrying. And this superinfection or mutation really results in hemorrhagic erosions of the muzzle, all the way through the GI tract, so all the way through the intestine, and these hemorrhagic erosions cause this bloody hemorrhagic diarrhea that you'll see in mucosal disease cases. And these animals waste quite quickly over 3 to 4 weeks, and this disease is always fatal. These pictures are courtesy of Keith Cutler, but you can see here, looking at the muzzle of this animal, that she's got these hemorrhagic erosions on her nose. If you opened her mouth, you'd see that she also had them in there as well, and that'll continue all the way through her intestines, and she'll have this hemorrhagic diarrhea that's coming out at the other end. So mucosal disease is an end point for PI animals, but not all of them succumb to it. So it's not true to say that all PIs will die of mucosal disease. You'll cull a lot of them out because they have poor fertility and poor growth rates as well before they even get to this stage. So you may or may not see this. Disease. And I just want to finish with a slide that sort of sums up all of this information so you can sort of start to think about what you need to think about to figure out if BVD is affecting your herd. The first thing is fertility. If your conception rates are poor, if you've got early returns to service or irregular returns to service, if you get abortion storms as well in your females, then poor fertility and BVD could be at the basis of this. Don't forget the bull. BVD infection in a bull will cause him to have poor quality semen and poor fertility himself. So a bull that's not performing could be a BVD problem in your herd as well. Other diseases, respiratory diseases and scours, particularly in calves. So because BVD is immunosuppressive, you'll see respiratory disease and scours that are much, much worse than they would be if BVD wasn't present in your herd. The other thing, of course, though, is that it affects your adult cows, and so you might see lameness, mastitis, cell counts. All of these diseases that affect infections that affect adult cows may be worse if BVD is involved. And if you feel that you've dealt with the other management factors that can have a major effect on these diseases, then do think, is BVD at the bottom of my lameness problem or my mastitis problem? Might just be as simple as your herd isn't producing as much as you expected. So again, poor milk yields, poor growth rates, these can often be down to a BVD problem in your herd. So if you're worried about this, maybe think about BVD. Have you ever had a case of mucosal disease? If you have, it's related to a BVD problem. What happened next? What happened after that? Did you find the other PIs? Did you double check that there were no more PIs in your herd? And if so, it might be worth going back and looking to make sure that you've dealt with the issue of PIs if you've had a case of mucosal disease in the past. Have you ever had calves born with these congenital defects, so cataracts, poor coordination, fused or abnormal limbs? If so, then BVD could be at the bottom of that. With this last point on the list here, with the fused or abnormal limbs, we could be talking about Schmallenberg virus as well. The presentations for some of the outcomes can be very similar. And what about that runty heifer, that animal that just won't get in calf? I very often come across farmers that persevere and persevere trying to get a heifer in calf, and she'll be 5 years old maybe before she has her first calf. Is she a BVD animal? Is she a PI? In which case, it's worth talking to your vet and thinking about this disease. And best advice is to talk to your vet about the disease and see what they think, see if they want to run some diagnostics to see whether your herd is infected. Now, next week, we're going to talk a little bit more about the diagnostics for the disease. So I haven't touched very much on bulk milk samples and blood tests here, but we'll talk a bit more about those next week in order to try and help you get to grips with the tests that you could do and what the results might mean.
Okay, thank you very much, Richard. So if anyone's got any questions that they want to ask Richard at this stage, then you can type your questions into the chat box, and so we'll just hang around for a few minutes just in case you've got any questions that you want to ask.
I think so.
That's fine. So I would like to say we will hang around for a few minutes if you do think of a question in the next few minutes. But I would like to say thank you very much for all of you for logging on and listening to this webinar, and thank you a lot to Dr. Booth about giving a very practical insight into how you can recognise BVD on your farm. And as Richard said, the main thing is if you recognise any of these signs within your own farm, then speak to your vet and ask about whether BVD could be the cause. So we've got one question here, which is says, is there any evidence that herds are more susceptible to bovine TB if they are infected with BVD?
It's a good question, I think, and I think it comes up quite a lot. I have no doubt that a herd will be more susceptible to bovine TB if you've got this immunosuppressive BVD virus in your herd as well. We're currently trying to get some research done at the college here to look at the associations between these diseases. So there's not a lot of literature out there that states for working herds that these animals will be more susceptible, but there's a bit of experimental evidence that shows that calves that are infected with BVD are much more likely to come down with TB if they're introduced to the disease at the same time. So there is a limited amount of evidence, but I think the real trouble's been collecting it. So you never know, if we manage to secure the funds to do the research, we might come calling and see if you'd like to join a study to look at whether BVD increases your susceptibility to TB.
Okay, so we've got a couple more questions come in, which is great. We've got a few questions come in now, which is fantastic. So the next question is, we had 5 heifers sampled for BVD antibody last year, and they all came back as positive. This year, the new heifers came back negative. Should an antigen test have been done? What are the chances that there are 3 out of 12 heifers PI? Is it worth antigen testing the whole herd? That sounds question is there.
First question that I would ask would be the age of those animals when they were tested. We will touch more on this next week, I think, but if the problem with one of the issues with the antibody test can be if we test animals too young, and if they're under 6 months of age, then we can often pick up colostral antibodies from the mother. So if they were young animals, then it could be because they could have been positive because they still had colostral antibodies from their mum. The other thing, of course, and what you've said is quite right, that if these animals are antibody positive, then this indicates they've been exposed to the disease, and so it's likely that the disease could be circulating on the farm. So I perhaps might have gone on and done an antigen test on other animals on the farm after that. The fact that the next year the heifers have come back negative is quite curious, so it suggests that the disease isn't circulating in the herd during that second year. It's a really tricky question to answer without seeing a bit more information about the ages of the animals, the groups that were tested, and sort of the structure of the herd, really. But generally, antibody-positive animals will indicate they've been exposed generally to a PI animal, but that is provided that they're old enough to be tested by the antibody test. I don't know if that answers the question or just causes confusion.
Thank you. We've got a question here from Sophie saying, are there any other therapeutic options than to get rid of the PI animals?
Really, the only successful way to get rid of this disease is by eradicating PIs. We can talk about vaccines. The vaccines are good, but in our experience in Somerset, they weren't enough to eradicate the disease from the herd. What they will do, though, is damp down the effects of acute infection. So you'll see fewer abortions, you'll see less fertility problems, and you'll see fewer secondary disease problems because of the immunosuppressive effects of BVD. But if your aim is to eradicate, then we need to look for PIs and get rid of those.
So we have a couple of other questions here. So one question was, what impact does the constant challenge of a PI animal have on an animal that is already immune to BVD?
It's a good question, and generally, once an animal's been exposed to a PI, their immunity will develop over a 3 to 4 week period, and by 28 days after infection, they'll have a pretty high level of immunity. What we currently know is that these animals will probably be immune and protected for up to about 3 years after they've been exposed to the PI animal. After that, the immunity will start to wane, and if they come back into contact with that PI, they can see the same effects, the same fertility and immunosuppressive effects again. So you do get long-lasting immunity after infection, but that immunity is not 100%. It's not in all animals in the herd. So it doesn't tend to last more than or beyond 3 years, really. So these animals will become susceptible again eventually.
So we have a question from Catherine Cole saying, I think we will talk about diagnostics a bit more next time, but the question was, do you rate the milk test to pick up problem cows / PIs?
It depends, Catherine, I think, which milk test we're looking at. So there are two out there, really. One is a PCR test, which looks for PIs in the milking herd, and the other one is an antibody test, which looks to see whether your milking herd's been exposed. We've had pretty good success in the herds that we've worked with using the PCR test. If it comes back positive, it probably means you've got a PI in your milking herd. At the moment, the milk tests are only rated up to about 300 animals. So if you've got herds that are larger than 300, we might need to think about different ways of testing that herd or splitting the herd and taking multiple milk tests. But that's the sort of thing that your vet can advise on. But up to 300 animals, if there's a PI in there, the test is pretty reliable. For the antibody tests, I think we'll go into more detail about those next week, because there's probably not enough time to describe what they mean today, but they're effective if they're used and interpreted correctly.
We have a question here from Gillian Follows. She's saying, I tag and test my calves. This has been done for the whole herd now, and they have all come back negative. Does the test tell me that the dam is negative, or the calf, or both?
It'll be both, actually. So if you test a calf and you're 100% sure who the dam is, so no mismotherings occurred, then if the calf is negative, you know the mum is negative as well. So if we look at it the other way around, if you pick up a PI, you really need to go back and look at the mum after that. So a PI cow will always give birth to a PI calf. So if you find a PI calf, the mother becomes suspect. So basically, if you've tested your whole herd and they're all negative, you're lucky because you've got a BVD-free herd now.
Okay, I think that's all the questions for now. So I think it's clear that that next week's webinar will be of a lot of interest to people, because that does go into more detail into all of these kind of diagnostic tests and how you can how you can diagnose the disease on your farm. So so that's all the questions for now. Just to say thank you once again for listening, and thank you for Dr. Booth for carrying out the presentation, and we look forward to welcoming you next week.
Thanks, Rosa.